Guess what we're talking about this week? Death. Trick questions, pathology. We're also always talking about death. All right. Any questions from last week? And we kind of skipped over some stuff at the end. Last week's stuff was pretty foundational. So every week we're going to be kind of building on stuff. So don't get behind. Ask questions if you have them. Yeah.
Sorry, as I do my questions, what do you have any good recommendations for what normal is as a database? Because I think we did a lot of gross specimens, but they were like formaldehyde.
Yep.
So it might be a little difficult to then recognize normal. Also to like the inside of the intestine and stuff. Do you have a good database recommendation or anything?
Yes. Come to the necropsy gallery all the time and just look. Just look and see and touch. Yeah, and smell.
Allowed to take photos of the things you guys need probably if we're not gonna ship and dispose our own.
You can, as long as you don't share anything anywhere ever. Oh, yeah, no blood and guts on Facebook, please, thanks. Good question. Yeah, it's really just seeing a bunch of stuff and getting experience with what fresh bodies look like. So yeah, come hang out in necropsy whenever you have a couple spare minutes. Other questions? Yeah.
For the assignment, we have to describe the two photos. Are you gonna post like the you would describe?
There's a key.
Okay.
Thanks for reminding me. I'll post it this week. There's also a bunch of assignments that I need to create for this week that don't exist yet. So you're like, no, see, here's what we did this year. We added assignments because your grade used to be like 80% your exams. And nobody, yes, so I'm making new assignments, but I have to make them yet. So also look, we have closed captions now. Thanks, Glover. All right, ready for week 2 stuff. Adapt or die. All right, everyone familiar with the concept of homeostasis? This is all the ways our body tries to stay in its normal zone. Homeostasis is like the normal ranges for everything. Normal range of temp, heart rate, blood pressure, whatever. For any variable, there's kind of this wiggle room, this flow of a body that's alive. I'm not articulating this well. A body that's alive is not static, right? It's always kind of responding things are always happening. The environment is always trying to kind of poke you out of homeostasis, and your body has to be like, whoa, back in homeostasis. It's like your body's on like one of those balance boards. It's like, I'm trying to stay up no matter what happens. So homeostasis is basically everything you've learned up to this point. How do normal bodies exist? Not even react, but just how are they at their baseline? What is normal anatomy, physiology, all normal stuff. That is not what we are doing here today. We have to know what normal is, but in this class, we're going to poke and disturb homeostasis and see what happens. It's going to be fun. We're going to fuck shit up. That's pathology. Yeah. So what happens when we come out of homeostasis? What happens when we can't keep the teeter-totter and we fall off? What causes us to fall? What does that look like? It's like a nice scorpion. I don't know if I would say nice. It looks painful. Yeah. Okay, so today and this week in a nutshell, we're starting at homeostasis. That's always a baseline. Pathogenesis, we're starting from a normal, healthy animal, right? We're going to add an insult. So we are going to perturb the system in a severe way and see how it responds. Here are the basic choices. If I insult you, knock you out of homeostasis, you can degenerate, which is a reversible change. If I remove the insult, you can recover with degeneration. Degeneration is reversible. If I don't remove the insult and I keep poking at you, you will die. Okay, so degeneration is an early change. It's reversible. You can come back from it if the insult is removed. If we don't remove the insult, degeneration is going to progress to necrosis, which is irreversible. That is death. Classic, simple example of this is a sunburn. You stay out in the sun a little bit too long, you get degeneration of your skin. If you get out of the sun in time, you remove the insult, you will recover and you will get a lovely tan and you'll look awesome. If you stay in the sun too long for your skin to handle it, you will progress to necrosis and you will start losing some skin. This is death of skin, right? When you get a bad sunburn and it flakes, that's death. It's irreversible. Does that make sense? So keep that big picture in mind. That's what we're doing today. All right, we're gonna shrink down really small and do that on a cellular basis, okay? So when we're talking about specific types, can I move this? Sick. Sick, not dead. Yeah. All right, when we're talking about a cell in homeostasis, you guys have thought and learned a lot about bodies in homeostasis, whole bodies. Now we're going to think on an individual cell level. So one of the most important things a cell does to make homeostasis for itself is regulate osmotic balance, regulate the flow of solutes and water. Do you guys know, have you had in physiology yet, which cellular structure regulates osmotic balance in the cell? The what? The plasma membrane maintains it, so you do need a barrier, but what actually, you need something to establish a gradient. The sodium potassium ATPase pump, that's your dude. He does this. Sorry. All right, so essentially your cell is a bag of solutes floating around in water, right? So water flows the movement of solutes. If a cell was not doing anything active to control this, water follows solutes, water would come into the cell. Because the cell is a little bag of salt floating in water. Does that make sense? So because we have a sodium potassium ATPase pump, we can pump things, move things around, and keep the cell from swallowing up the water. So that's a happy, healthy cell in homeostasis. Sodium potassium pump is pumping sodium out. It's pumping potassium in. Water follows sodium. Water is going to be pumped out of the cell. So the cell is like a boat that's continuously low level bailing a little bit of water out. Stay afloat. Actually, it's bailing salt out and water is following salt. So what do you guys think would happen to the cell if we suddenly just stopped this pump, this sodium potassium pump?
Yeah.
Not yet. The cell is going to start swelling because where is sodium? What's going to happen to sodium? Sodium is going to increase in the cell. What about potassium? Potassium is decreasing, but there, see how big the sodium is? There's much more sodium being moved around than potassium. So water is going to follow sodium. Water is going to come into the cell. You're going to swell. So backing up a second, ways to insult a cell. There are a lot of ways to do this. Probably the most common, and the thing that a lot of these actually have in common, are oxygen deficiency. That's like the most basic, classic, stereotypic way to insult a cell. It's to disrupt its oxygen metabolism. Lots and lots and lots of things to this. We're going to spend an entire quarter learning about all the ways to disrupt homeostasis. This lack of oxygen, as I said, this is a particularly common insult, extremely common. We're talking about basic mechanisms. So just a couple words I would like you guys to be familiar with. These are not interchangeable. Hypo means less. So hypoxia means I don't have enough oxygen, but I have a little bit. Versus anoxia, a or an means none. That means I have no oxygen. Ischemia, remember I told you guys that emia means of the blood, has something to do with the blood. So this is indirectly related to oxygen supply. This is blood flow. So if you lose blood flow to an organ, it will be hypoxic or anoxic, but it'll also be ischemic. You guys see how those are not quite the same thing, but they're sort of related to each other. All right, and again, many things can cause a loss of oxygen supply to tissue. We talked last week about mass effects, so cells just becoming separated from their blood supply, disruptions of blood flow if you don't have enough red cells. So many things can cause this particular insult. no matter what the initiating cause is, the result is a cascade of stereotypical cellular responses. So by stereotypical, I mean it's classic. It happens the same way every time. You can count on it. Step one, no matter what happens, we have a reduction in oxygen to the cell, any of those etiologies. If you don't have oxygen, you can't make ATP. If you can't make ATP, you can't run your sodium potassium pump. If you can't run your pump, you lose fluid homeostasis, you swell up with water. So this is the classic cascade of degenerative responses. It is still reversible. We also call this acute cell swelling or hydropic degeneration. Hydro, like water. This is watery degeneration, basically cell swelling, the cells filling with water. Because this is such a classic thing, you might hear me just say degeneration. If I say degeneration without a modifier, this is the one I'm referring to, hydropic degeneration. All right, so again, if we stop this pump, sodium is going to accumulate in the cell, water is going to be retained or flow into the cell. We will be in this situation. Bursting imminent, okay? All right, so I'm giving you the same information in a couple different formats, just so you can digest it. Here's the cascade. We start with hypoxia. We don't have ATP. We can't use the pump. We get water building up in the cell. That's the whole thing. So what this looks like is swelling of the cell. The cell itself is going to swell. It's going to be a little bigger. It's going to be a little more pale because we're adding water to the cell. We're diluting the cytoplasmic content and the organelles. Your organelles can also swell. So your ER, your Golgi, your mitochondria, these will all start swelling. However, degeneration by definition is reversible. So there is nothing happening here that we can't recover from if we remove the insult. Your cell is swelling, but it has not yet exploded. All of your membranes are intact. So your cell membrane is still intact. All of your organelle membranes are still intact. We can get back to normal if we catch this cell in time. This is hydropic degeneration. We're low-key drowning. We could save this pug. He has not yet drowned, but if nobody intervenes, this pug is in trouble. Okay? Questions so far? Sweet. All right, so important. Degeneration is reversible by definition. The cell is deteriorating, but the insult is sublethal, meaning not enough to kill the cell. So these are insults that we can recover from. They are, by definition, usually either not severe or not prolonged, or both. The cell can get back to normal if we take the injury away in time. Again, there's a lot of changes going on in the cell. The cell looks different. The biochemistry is different. The cell is basically in survival mode, but it is surviving. The cell membranes are intact. The nucleus is intact. So if we restore oxygen to this cell, the pump will start up again. Because we have an intact membrane, we will be able to reestablish that gradient and get back to homeostasis. Okay. Everybody know this movie? It's your homework assignment to watch this movie if you've never seen it. Monty Python and Holy Grail. Classic. For some reason, I was made to watch that a lot in my high school English class when the teacher didn't want to deal with us. She's like, Monty Python. Learning. Okay. Morphology of degeneration. Think about it on a cellular level first. We're adding water to the cell, we're swelling. So the individual cells, these over here are nice dark pink happy hepatocytes. These over here are swollen, pale, degenerating hepatocytes. I can still see a cell membrane, we're intact. I can see a nuclear membrane, the nuclei look good, but these cells are in trouble. Same thing on a whole organ basis. The organ itself, you've added water to all the cells. So the organ is going to have increased water. It's going to be wet and heavy. It's going to be pale and swollen. It also might be a little bit more soft than normal, depending on the organ. Yeah.
Is the color more pale because there's just more water in the cell, so there's like less pigment, it's proportional now.
Pigment, like organelles,
Yeah.
blood, yeah, you're diluting everything with water, so the organ's getting more pale. Just like with glycogenosis, you're diluting the rest of the organ with a substance, you're gonna increase power in that organ unless that substance is something really dark, like pigment or blood.
It is a question.
Yeah.
Is the size of the, like on an organ level, is the size of the organ actually changing or?
It sure is. Do you remember how we talked about sharp borders?
Yeah.
This liver has a nice sharp border. This liver has a rounded border.
Why is the size of the organ changing? If water is moving from,
Why is the size of the cells changing?
well, the water is moving from the intracellular space to the cell. So wouldn't the volume of the water in the whole organ still be the same?
Oh,
If you're just having a shift.
you're trying to trick me with physics. Don't think about it that deeply.
Okay.
Yeah. An organ is mostly cells. Most of the water in the organ is inside of cells. So if all the cells get bigger, the organ will get bigger. Don't go physics on me. Good questions though, just above my level. Okay, so which of these mouse livers is undergoing degeneration, do we think? The left. Your left, my left. This one?
Yes.
Yes, yes, it's enlarged, it's swollen. If you get really close to the screen, I can see an enhanced reticular pattern in that liver. Do you see it? If you can see a pattern on a liver, it's an enhanced reticular pattern. Okay, big, heavy, wet, soft, swollen tissues. Fatty degeneration. This is another kind of degeneration, but instead of adding water to cells, we're adding lipid. So we already talked about this last week, right? We talked about lipidosis, swelling of the organ. This is the same thing, except we're doing it with fat instead of water. Hydropic degeneration can happen anywhere, any organ, any place, any time. Fatty degeneration tends to occur with organs that have high lipid metabolism or storage. So liver, then kidney, then maybe other things. This is mostly a liver thing. Okay, so a normal liver does store lipid, but usually the lipid droplets are not, there's not enough lipid there to be microscopically visible, right? So when we're looking at a liver, there is lipid here, the metabolism is doing lipid storage, handling, metabolism. There's just not enough to see. Once there's enough to see, remember we have an oil-water interface. So these droplets of lipid are gonna coalesce and make these big fat bubbles in the cell. Super importantly, fatty degeneration occurs in non-adipose tissues. Fatty degeneration does not happen in fat. Write that down. We'll be confused there. So, pathology. Same as when we talked about with lipidosis, the tissue is going to be enlarged, it's going to be pale, it's usually going to be yellow and greasy if it's severe enough, and it's going to be soft and friable. The organ will also often be enlarged in severe cases. Here's what that looks like grossly. This is actually, I think many of these are human livers because this is a really, really common disease in human beings. So if a normal liver is here, it's this dark mahogany. Here's, I would even call this getting fairly severe. They call this moderate. This is severe. If this is severe, I don't even know what this is, right? This is just, this liver is no longer a liver, it's a fat blob. Yeah.
So when you're describing lesion, like, let's say we're describing these livers, you can't say that the liver has fatty degeneration. Because, right, that's my question. Could you say that the liver has fatty degeneration or lipidosis, or would you only be allowed to describe the color texture and things?
Descriptions are adjectives. Lipidosis is a noun.
Okay.
Lipidotic is an adjective, but I would probably ding you for that and say you're trying to get away with interpreting.
It's trying, these things are more interpretations rather than.
We are now learning interpretations. This week on, we are learning interpretations. and I'm giving you the descriptors.
Right.
So when you have these descriptors, the liver is diffusely enlarged, pale, yellow, friable, greasy. If I hear all those words, or if you hear all those words in a liver, your mind goes, that's lipidosis, right? So we're starting to learn how descriptors connect to interpretations. The words you choose in your descriptions are important.
Is the yellow coloring due to buildup of bile, bilirubin, because the liver is going through fatty degeneration and can't function?
It's fat. Fat. Yellow fat.
On the previous slide, you were saying that the fat droplets, those are all, like, you know, the tubes are all within the cell still?
Yes.
Cell?
Yes.
Okay.
Yep. Good questions. All right, classic disease example. I know some people have already seen this because we've already talked about it. Fatty degeneration, hepatic lipidosis in a cat. A fat cat that comes into your clinic, stops eating for literally any reason. The animal or the body thinks it's starving. It says, I need homeostasis, I need nutrients. There is no glucose available for me, but look, there is a hell of a lot of fat. I'm gonna chow down. So the body starts metabolizing fat. It's too much for the liver. Liver can't handle it. We start to clog the liver with fat. Lipid accumulates in hepatocytes. You start to get degeneration of hepatocytes. So eventually we'll get so much lipid inside of hepatocytes that they can't function anymore. They go into survival mode and they're like, we're in trouble. Okay. Remember that degeneration is reversible if you remove the insult. So what's the insult in the case of a cat with anorexia? Really is the insult, right? So you want to feed this guy. Yeah, force feed him if you have to. Give him IV parenteral nutrition, give him something. The cat starts eating, we're going to slow down and decrease lipid delivery. The liver will be able to recover. It'll be able to process all the lipid that's in there and get back to homeostasis, right? If the cat doesn't start eating, degeneration will progress to cellular death, which will progress to death of the animal.
Do we know the mechanism of the generation of the cell, like in the other example, right? It osmotically relevant, in this case, it's just like, oh no, so much fat and then.
It's really kind of the same thing. So these things that we're adding to the cell are space occupying, right? If you look at this poor guy, if this is a hepatocyte and there's his nucleus, how much bile making or drug metabolism, how much of any liver things do you think this cell is going to be doing? There's no room, right? It's like if I filled your study room with balloons and then told you to study for an exam, you probably have a hard time, right? That make any sense?
I think I know the question I want to ask.
Okay.
So you said the insult is anorexia,
Mhm.
and I was like, oh, well, I think I would have said, oh, these fatty, droplets that are taking over. So now then I'm wondering, okay, are we talking about the etiology? Are we talking about secondary or sequela?
So I have a question here.
Oh God, what?
So anorexia is not the etiology, it's the insult right now. It is the cause of hepatic lipidosis. If we're talking about pathogenesis of how did this animal go from healthy to sick, why did this animal stop eating? The answer is in the image. Anybody see?
Foreign body.
Where do you see a foreign body?
No, it's just a guess.
Why did you guess foreign body?
The intestine, the kind of bubbly.
Kind of bubbly? Okay.
So it's like dilated. It's like air. Maybe the only formulation.
I don't know if I'm buying the dilated intestines.
There are.
What thing? This thing?
Tissue.
What's that?
On the right side. Under.
That's a kidney. Look at the subcapsular vessels. Remember, that's the right kidney tucked up under the liver. This is intestine. This thing, if we're thinking that's a mass, that's intestine.
The liver is like color.
Yeah. This is a necropsy, my dear. We've opened the chest, there's the lungs. Yeah, this is a dead animal. So this was obviously not reversed in time.
I would say lack of blood supply to the intestines, but I think that.
Yeah, no, it's not that. Can I get a volunteer wearing a hoodie to come up here?
Question while volunteer comes up?
What?
May I ask you a question while volunteer comes up?
Yes,
Is that normal color for the intestines? We've only seen.
that's normal postmortem color for intestines, pale pink.
Thank you.
Hi, you don't have any strings. Do you have strings? No. I need some with strings.
Yeah.
Okay, yeah. Does anybody know the word for this? Plication. Do you see it?
So it's all
No.
the string.
It swallowed a
A
string,
foreign body.
a linear foreign body.
Yes.
You were right, but you didn't hit right for the wrong
On
reason.
the left side of it, that's like.
All of this. Usually you open a belly and the guts are all like, right? They're just kind of like chilling. I can move them around. These guts are in a wad and they look like that hoodie. They're plicated. So this animal stopped eating because it had a linear foreign body. They probably tried to give it nutrition, but they didn't for the ultimate cause, right? They didn't find the calcium. All of this is plicated and all wadded up and all. Okay. We didn't come to necropsy, just look at open abdomens. They look very like loose and like full.
So,
Everything's wadded up in one area, like there's all this empty space on here. That's weird. Right? Again, you need to see lots and lots of bodies open. I will show you as many as I can in here. Fatty degeneration, lipidosis, often diffuse, can occasionally be focal. This is a horse. Does anybody know what this thing is right here? This is an anatomy question.
oh, this is the.
It's one of the ligaments attaching the liver to the diaphragm. I forget the name of them. It's one of those. So. Sure.
One of the.
The one at the top, I don't know. Yeah, this is how much anatomy you need to know once you get out. You're like, okay, I know all the major organs and all the like biggest bones. Okay, so what's happening here is if you're a horse, your liver is like this, your liver is suspended in your abdomen by these ligaments, right? And a horse liver is heavy. So what's happening right here at the side of this ligament, there's a lot of tension on the liver right there. This is called tension lipidosis. Tension causes lowering of oxygen supply. You're stretching and stressing the tissues. So that's when you can get a focal lipidosis, and it's always centered right around these big ligaments. The liver is dangling in there. So this is really only a large animal thing. Usually fatty degeneration lipidosis is this more diffuse. This is an important lesion that will kill the animal. This is an incidental finding. Right? When we think of how severe this is a cut piece. So we've taken a tiny little piece of an entire horse liver, and this much is affected by lipidosis. The liver's fine, the horse is fine. This is an incidental finding.
I know we have like a certain percentage for the kidney, like how much of the kidney could we lose while it still functions?
Yep.
Do we have that number for the liver?
We have it for every organ. In the liver, I think it's like 70%.
Oh, so it's kind of similar to the
Lot.
kidney?
Yeah.
Okay.
So this is maybe affecting like 1% of the liver. Not impressed.
So in this specific case, the insult is ischemia.
Yes. Yeah. Well, ischemia is secondary to like tension.
I think the answer is no, but would this then make the animal's liver overall just not as good as an animal's liver that doesn't have this full effect?
I think this liver would be fully functional.
Because of the like 70%.
It has 99% of its liver is totally normal. Yeah. also remember this is degeneration, this is not necrosis, yeah, so these cells are surviving, they're just not super happy.
Fatty is not fiber, you know, I feel like.
Because liver,
Yeah.
Yeah. the liver does so much lipid metabolism that when things start to go wrong, lipid builds up. Frequently. Good questions, getting to know the liver. Okay, so comparing hydropic and fatty degeneration. Hydropic degeneration or just regular degeneration, we're adding water to the cell. So you're adding water to water. The cells are going to be big and swollen and fluffy. But we're degenerating, we're not necrotic, so look, all the cell membranes are intact, all the nuclei are intact. But you can tell these cells are miserable, right? If these are normal, these guys are not okay. Fatty degeneration, we're adding lipid to water, we get smooth, sharp bubbles. Cells are still swollen, but they're swollen by these big vacuoles. Also kidney, believe it or not. Okay. Cells undergoing degeneration, whatever the type. Here's kind of what's going on from their perspective. One of the first things that's going to happen is you're going to notice what are called luxury functions. So these are basically specialized cellular function. Anything that's not related to the immediate survival of the cell. Your cells are not looking out for you as an organism. They are looking out for themselves as cells. Does that make sense? So you might lose things that are important to your survival to keep the cell alive because the cells are prioritizing their survival. So an example of this, cilia in your respiratory tract are considered a luxury function. The cell does not need those to survive. Your body needs them to survive. So if you get degeneration of your respiratory epithelium and you lose your cilia, you are much more prone to infectious diseases of the respiratory tract, right? So we're talking about survival only on a cellular basis, right? Hormone secretion, enzyme production, absorbing nutrients, basically anything that's not just surviving and getting by. These are cells in crisis. Microvilli, so in your intestines, your absorptive surface. Another thing they're going to do is remember that oxygen depletion or lack is one of the most common insults. So they're going to cope with that by switching more from aerobic to anaerobic metabolism. It's going to produce a lot of toxic things and it's not as efficient. So lactic acid is going to build up. It's acid, so it's going to cause additional damage in the cell. But we're doing the best we can here, right? These cells are like supermarket workers during COVID, right? Or like nurses during COVID. They're like, we just got to get by whatever it takes. Kind of trash bag over your face, we don't have a mask, whatever. So it's doing things that are not great for it, but it's better than dying, right? Building up lactic acid is better than just throwing in the towel. You're also going to start to get inside stuff leaking out of the cell, and they're going to be detectable in blood. So these are really important biomarkers of tissue injury. So probably the best example for you guys is liver enzymes. These are enzymes that are contained inside of liver cells. If they are increased in the blood, it means you have liver cells bursting open or leaking their contents. So these are blood markers of liver damage. So the cells basically start shedding things into the bloodstream, like, hello, find us. It's like message in a bottle, it's ALT, like liver in trouble. All right, questions on degeneration?
On the previous slide, it said increase in nutrient absorption. I guess to me that, it seems like it has more survival than the rest of the luxury items there. Can you explain why it's not?
A cell needs oxygen more urgently than it needs nutrients. Yeah. Because no oxygen, no ATP, no fluid homeostasis, no life. It's like your body can survive without food, but right. It's pretty important, but it's not the most important. Ranking instance. Other questions? Questions about how cute these are? This was Voodoo, my little cleft palate baby. He's no longer with us because he had the first ever reported case of Charcot-Marie tooth disease in a Boston Terrier. It's a degenerative neuromuscular, so he was not able to walk by like 18. But he was really cute and dumb. And that's his brother, Augie, who is still with us.